Today's nursing mindset is about thermoregulation, or how the body maintains a stable internal temperature. When you care for a patient with a fever, hypothermia, or heat-related illness, it's easy to focus on the thermometer. But as nurses, we need to think beyond the number. The real question is, how is the body trying to return to homeostasis? That's where everything on this graphic begins. At the center is the hypothalamus. Think of the hypothalamus as the body's thermostat. Just like the thermostat in your home constantly monitors the room temperature and makes adjustments when it becomes too hot or too cold, the hypothalamus is constantly monitoring your body's core temperature. Its goal is simple: maintain a normal temperature so the body's cells and organs can function properly. So let's look at what happens when the body becomes too hot. If your temperature rises above the body's normal set point, the hypothalamus activates mechanisms to lose heat. You begin to sweat, allowing heat to escape as sweat evaporates from the skin. Blood vessels widen through vasodilation, bringing warm blood closer to the skin's surface, where heat can be released into the environment. Together, these responses help lower body temperature and return the body toward homeostasis. Now let's look at the opposite situation. If your body becomes too cold, the hypothalamus shifts its focus to conserving heat. You begin to shiver. Those involuntary muscle contractions generate heat. At the same time, blood vessels narrow through vasoconstriction, reducing blood flow to the skin and keeping warm blood closer to your vital organs. Again, the goal is exactly the same: return the body to its normal temperature. The body can also influence temperature by changing how much heat it produces and loses. Heat is produced through normal metabolism, exercise, shivering, and in newborns through specialized brown fat, because infants cannot shiver effectively. Heat is lost through four mechanisms that you'll hear frequently in nursing: radiation, which is heat lost without direct contact; conduction, heat lost through direct contact; convection, heat lost through moving air; and evaporation, heat lost when liquid, such as sweat, changes into a gas. As nurses, we also recognize that not every elevated temperature is the same. One common misconception is confusing fever with hyperthermia. With fever, the hypothalamus intentionally raises the body's temperature set point as part of the immune response. The body actually wants to be warmer because the higher temperature helps to fight infection. With hyperthermia, the set point never changes. Instead, the body becomes overwhelmed by heat and cannot cool itself effectively. Understanding this difference helps explain why patients with hyperthermia often require active cooling measures, while patients with fever are frequently treated for comfort and to address the underlying cause. Finally, remember that the body isn't working alone. Behavior also plays an important role. We regulate our temperature by adding or removing clothing, adjusting the room temperature, seeking shade, or finding warmth. But not every patient can do this independently. Infants, older adults, and patients with cognitive impairment often rely on caregivers to recognize temperature changes and help regulate their environment. So whenever you assess a patient with a temperature concern, don't stop at asking, what is the temperature? Instead, ask yourself, how is the body trying to maintain homeostasis? That simple question will help guide your assessment, your interventions, and ultimately your clinical judgment. Remember, every safe nursing decision begins with the right mindset. Keep developing your nursing mindset, and we'll talk in class.